My name is Tracy Kesey, and I am the president of HTA Insurance Services, and I'm so happy to be with you today to learn a little bit more about Medicare. Who's ready to talk about Medicare for the next hour? I know it sounds super exciting, but I promise I will try to keep it interesting, and hopefully you walk away with some new knowledge of Medicare. Before we get started, I just want to let you know, we always get asked, there are copies of these PowerPoint presentation slides in the documents icon in your web browser if you're watching this live through GoToWebinar. Also, there's a chat bubble there for you. Please ask your questions. We will email you back with the answers. Now, everybody who registered for this presentation will get a recorded copy of the replay. So if you're watching this on recording, you won't be able to ask questions or download the documents, but you could always just reach out to us directly for that. So with that, I'm going to pop off my camera and I'm going to get the slide loaded up and we will get started with the presentation. So thank you so much. Thanks for being here. Thank you for joining us today on the Roadmap to Medicare. My name is Tracy Kesey and I'm the president and CEO of HTA Insurance Services. And I'm looking forward to spending the next 45 minutes to an hour teaching you about Medicare. But before we get started, I'd like to take a moment and just tell you a little bit about HTA. We help simplify and solve complex insurance decisions as they revolve around Medicare. And what we specialize in is walking people through their Medicare onboarding process. So that starts early, even pre-65, learning about what your timing is to go into Medicare. And then the next step would be the actual enrollment in Medicare when you're ready, Medicare A and B. And then in picking out and enrolling in your secondary services. That's your onboarding process. And then once you become a client of ours, we will give you year-round VIP support services. You can ask us any questions. We help with billings and claims and coverage issues. And we're here to do an annual review on your coverages each year during the annual enrollment period if you'd like our assistance with that, which is an exclusive service that we only offer to HTA clients that onboard with us into Medicare. And what makes HTA different? Well, we have almost 20 Medicare advisors that do nothing all day except for helping people onboard into Medicare. So they truly are knowledgeable in this field and have helped many, many people, and they can bring that expertise to you with over 20 years of industry experience, unlimited professional support, and access to over 20 insurance companies. And our promise is that you will never get any unwanted phone calls, no pushy sales agents, and we want to be on your team. And honestly, that's what really makes us stand out. The fact that we are leading with heart. Check our reviews out on Google and you'll see for yourself just how much people love working with us. And the way we're able to accomplish that is all of our advisors here at HTA are salaried employees. They're not commission-based, they're not incentivized to sell you anything, and therefore all of their recommendations are going to be unbiased, friendly, supportive, and there's never going to be any pressure to buy something. And the best part is, there's no cost to working with HTA. It's no cost to you, your family, your friends. We can help anybody with their Medicare onboarding experience nationwide. We're licensed in all 50 states. And you do not pay more in insurance premiums by using our support and enrollment services. And to be completely transparent, our only request would be that when it does come time to enroll in Medicare, because at some point in your life you will have to enroll, please utilize us to help fill out the paperwork and complete the enrollments in your insurance products, because that's how HTA ultimately continues to get paid. HTA is paid by the insurance companies for educating and helping people enroll in different Medicare parts and pieces. So we're going to go over a lot of information today, but remember, the slides are available for your reference as well as the recorded replay. We're going to first start off by talking about all the parts and pieces of Medicare, what the benefits are, and what you can expect for costs. We'll dive a little bit more detail in the differences between Medicare Supplement or Medigap and Medicare Advantage plans, and those plans you see advertised on TV. And lastly, we'll spend some time on enrollment timing. So when should you be enrolling in Medicare in line with your retirement goals and objectives? So let's dive right in. What is Medicare? Medicare is the health insurance that you become eligible for when you turn age 65. So anybody Age 65 and over who's lived in the United States for at least 5 years and is a permanent resident or green card holder qualifies for Medicare. Also, possibly those that are under age 65 if collecting Social Security disability income or have end-stage renal disease like kidney failure, kidney dialysis, or kidney transplant. Now, many people think that qualification has to do with their normal retirement age, but normal retirement age is actually the age when you qualify for your full Social Security income benefit. 65 is the age when you become eligible for your Medicare benefit. So everyone has a choice to make at age 65. Do I enroll in Medicare like all of the threatening literature says I have to do, with deadlines and penalties and must enroll now? Or do I have a valid reason to defer my Medicare and enroll later? When you do enroll in Medicare, it's kind of an alphabet soup. You need several parts and pieces to make up comprehensive health care. So you'll need Medicare A and B, which is through the federal government. And then you'll need some form of Medicare Part C, which is Medicare Advantage or Medicare Supplement, and some form of D for drug plans. And there's many carriers that offer Part C and D to choose from. The first part of Medicare is Medicare Part A. And when you think A, think of A for admission into the hospital. Part A is your inpatient coverage. Generally, there's no cost for Part A, provided you or your spouse has paid a minimum of 10 years of Medicare taxes throughout your lifetime. Then there's Part B. Part B is your medical outpatient services. So things like doctors and specialists, labs, x-rays, MRIs, surgeries, chemotherapy, even things that you go to the hospital for, like emergency room visits or observation, that's all covered under Medicare Part B as outpatient. And Medicare does have a cost for Part B services, and that cost is dependent on income. The only people that don't pay a Medicare Part B premium are those that qualify for Medicaid or state financial assistance to help pay their premiums. In 2024, the standard income bracket that would pay the base Medicare Part B premium would be for individual tax filers earning under $103,000 a year, or joint household tax filers earning under $206,000 per year. If you fall into this category, you will pay the standard Medicare Part B premium of $174.70 for 2024. But for anyone that earns more, you'll also pay more for your Medicare. So a couple things to notate here. Number one, the premium on the right is a per person per month premium. And the premium is going to be the same for each spouse. It doesn't matter who the primary breadwinner is in the family. If you file your tax return jointly, you will pay the same Part B premium for your joint household income. And people often ask me, what income are they looking at when determining Part B premium? And the answer is it's your modified adjusted gross income, but that can't be found anywhere on your tax return. So if you glance your eyes down near the bottom of your first page of your income tax return, you'll see adjusted gross income. And that's actually a very good estimate as to what the federal government is using when determining your Part B premium. But lastly, and probably most confusing to people, is the fact that when reviewing your income, they're reviewing your income from 2 years ago. So you may be thinking, well, 2 years ago when I was working full time, I was definitely making more money and it puts me in a higher income bracket. However, now that I'm retiring, my income's going down. So why should I have to pay more for Medicare because my income was higher while I was working? Well, there's an answer to that. Number one, eventually the federal government will figure out that your income's gone down. There is an annual review process, and every December when they announce the premiums for the following January, they base it on that 2 years prior. So 2 years after your income goes down, they will figure it out. But guess what? They're not going to back pay you for that 2 years that you overpaid for your Medicare premiums. So typically what we recommend is that there's a form you can file. It gives you the opportunity to say that you've retired or you've lessened your work and your income's gone down, and you state your anticipated income for the upcoming year. And typically they take you at your word and reduce your Medicare premium accordingly. Now, when they eventually do check your income in the computer, if they see that you underestimated your income, they'll come back and balance bill you for what you should have paid. but they're not going to give you the income back if you overpay during that time. So we always recommend it's worth filing the form if you're willing to take the 5 to 10 minutes it takes to fill it out. So if you have Medicare A and B only, you would have deductibles, copays, and coinsurances for many of your healthcare expenses. There is going to be a per admission hospital deductible that you would pay for each time you were admitted into the hospital. And if you were in the hospital for an extended period of time, you would also have daily copays while in the hospital. Now on the Part B side, the outpatient side, you have a nice low annual deductible that you would first pay on your outpatient services. But then after that, you would pay a percentage of each covered service. So for example, 20% on outpatient services, not too big of a deal if you have a $100 doctor visit, but could be much more costly if you have a $100,000 hospital observation bill. And the problem with Medicare, if you had A and B only, is that there's no maximum out of pocket. There's no cap on those expenses. So this could be quite a financial risk. In addition, Medicare doesn't cover things like dental, vision, hearing aids, or personal needs services like home health care, assisted living, nursing home, unless it's in an effort to rehabilitate you from some kind of medical condition. There are other insurances available that cover these things. In fact, some of these things are included in Medicare Advantage plan, but they are not part of the base Medicare program. So Medicare A and B is the first step. Now we have to choose, what do we want for our Part C? So Part C, otherwise known as Medicare Advantage, or we'll have the option to choose a Medigap plan, otherwise known as Medicare Supplement. So are we going to go down the Advantage route or the Supplement route? Well, under Medicare Advantage, this is an all-in-one program, and it actually replaces your original Medicare A and B. Now, don't be confused. You still have to pay the Medicare Part B premium, even if you go into an all-in-one Advantage plan. Now, the Medicare Supplement side of things, this is an a la carte program. So it's actually a secondary insurance that sits on top of your Medicare A and B. A and B remain your primary insurance. And again, you still have to pay your Medicare Part B premium. So let's first start off by talking about all those commercials that you see on TV. You know the ones I'm talking about. The ones that say your plan comes with free dental, free vision, gym memberships, over-the-counter things like vitamins, grocery, and guess what? We'll even pay for your Medicare Part B. Well, believe it or not, there are plans that actually do just that, and they're called Medicare Advantage plans. Many Medicare Advantage plans offer a lot of extra benefits included in them that aren't typically covered by Medicare. For example, you may get dental at a few hundred to a few $1,000s a year, a few $100s of routine vision. You could get free gym memberships at your local gyms. And one thing that's pretty neat is they give you a debit card and they refill this debit card for you every quarter, anywhere from about $25 a quarter and upwards of $200 a quarter to use on over-the-counter items like vitamins or Band-Aids. Some plans do give that grocery allowance that you've heard about, but typically restrictions apply. Certain diagnoses have to be in place to qualify for that, but some of them even have meals on wheels, like when you come home from the hospital for a couple days. And lastly, there can even be plans that give you money towards your Medicare Part B. So remember, I said you can't get away from paying that Part B premium, but there's Medicare Advantage plans out there that not only don't cost you anything, but they actually give you money towards that Part B premium, therefore reducing that expense for you. So let's spend a couple minutes comparing the differences between Medicare Advantage and Medicare Supplement. First, start talking about those extras. So all of those extras, dental, vision, hearing, gym memberships, meal programs, over-the-counter benefits, all of those may be included in a Medicare Advantage plan, including prescription drug benefits. However, in a Medicare Supplement, they are typically not included. Many of them you could purchase as separate plans, but it's an a la carte program. It's not automatically included in the supplement. Now let's focus on costs, both premium and cost of services when you need care. So the Medicare Advantage is going to have the lower premiums. As you've seen, many advertised at a $0 premium, and you can find many quality plans for $0. So it doesn't cost you anything to have the program. They are government subsidized plans, so they do get paid to have you as a member. You're just not paying them directly. But when you go to receive services, it's more of a fee for service plan. There's going to be some kind of copay attached to every service that you may need. Doctor, specialist, maybe it's only a couple dollars, $5, $10, $30, $50. Surgeries might be more like a couple $100. Inpatient hospital stays, maybe a few hundred to a couple $1,000 for an inpatient hospital stay. MRIs, maybe a couple $100, things along those lines. So basically, it's a menu of services that everything's going to have some kind of corresponding copay for. But if you get sick and need many services throughout the year, the plan doesn't cap your out-of-pocket limit until you've paid anywhere from, $5,000 to $8,000 or $9,000, depending on the plan. Now, on the flip side of that is Medicare supplements. You will pay a premium to have this type of coverage. The premiums generally range between $100 and $250 a month. That's going to depend on your age, gender, and zip code that you live in. But when you need care, when you need services, you are going to pay little to nothing for the services you need. Some plans may have a small deductible, but after that, it's typically 100% coverage with no copays and no out-of-pocket expenses. Moving along to the access to care. Medicare Advantage plans are managed care network-based plans. So what that means is that there's going to be doctor networks. So you wouldn't just ask your doctor, do you accept Medicare? You would ask your doctor, do you accept XYZ Medicare, Aetna Medicare, Cigna Medicare, Blue Cross Medicare? In addition, these are managed care programs. So when you need services rendered, it's you, your doctor, and the insurance company making the decision. So you're going to see things like prior authorizations, limits on certain services, and possibly some red tape when you need to access care. On the other hand, Medicare supplements are not going to be restrictive in the networks or the managed care. So there's no networks. You can use any doctor nationwide that accepts Medicare. So your question to your doctor truly is, do you work with Medicare? And actually, 99% of all non-pediatric doctors do work with Medicare nationwide. And there's no managed care. So you and your doctor are in control of your medical decisions. So you may be thinking, okay, well, I'm young, I'm healthy, I like the idea of all these extras, I like the idea of no premium. Maybe I'll go with Medicare Advantage for a few years, but then if something happens and I get sick and need more care and it's going to start to cost me more money and I want to have access to not as many networks or no managed care, then I'll flip over to the Medicare supplement side. Well, unfortunately, it's not quite that easy. Because when you first enroll in Medicare, you'll have a choice either way you want to go. But after you've been in Medicare for a little while, on the Medicare Advantage side, you will still have a choice. Every year you can change your Medicare Advantage plan during the annual open enrollment period. However, Medicare supplements will move to medical underwriting after you've been in Medicare for over 6 months. So if you go into a Medicare Advantage initially, and you decide while you're still healthy that you want to move over to a Medicare supplement, that's perfectly fine to do. However, if you get a diagnosis that leads you to that decision, that may be a little bit more difficult. So let's talk a little bit more in detail on how these plans work. So with a Medicare Advantage plan, you have an example on your screen of 3 separate plan designs, and you can see they each have varying maximum out-of-pocket limit. That's the most you'll ever pay in copays in a given year, no matter what happens to you. And then they break it down by service. So you can see doctor visit, $0 to $15, depending on the plan, specialist, $30 to $45, emergency room, $95, and then inpatient hospital stay. That's typically a daily copay of $200 to $300 per day, but it's capped at so many days. So usually no more than about $1,500 to $2,500 per hospital stay. This is just a small example of the menu of services that you would receive in the summary of benefits for the different plans that you were looking at. One of the biggest out-of-pocket risks with the Medicare Advantage plan are treatments like cancer treatment, because chemotherapy and other infusion therapies have a 20% copay. So with the cost of those therapies being so high, a 20% copay would likely have you hit your maximum out of pocket in that given calendar year. But if you remain relatively healthy, have a few doctor visits, maybe an outpatient surgery, some outpatient physical therapy, you're probably not talking too much more than anywhere from about $500 to maybe $2,000 in out-of-pocket copays for the average relatively healthy person. Let's take a closer look at how Medicare supplement plans work. Remember, these plans are secondary to original Medicare. So what we first want to do is look at the out-of-pocket expenses that we would have if we had original Medicare A and B only. And you can see here that we have the four most popular Medicare supplement plan designs listed across the top. All Medicare supplement plans are designated with a letter. There's 10 Medicare supplement plans to choose from, letters A through N, and some high deductible options. So let's first start with plans F and G. They are the most comprehensive, the lowest out-of-pocket risk in Medicare. And as you can see, if you look at the Medicare out-of-pocket expenses for the various services, and then you look at the column for Plan F, you'll notice that your out-of-pocket expense, if you have Plan F, is $0 for all of them. So actually, you pay nothing for any of your Medicare eligible services. You have a $0 maximum out-of-pocket. The next step down from that is Plan G. And as you can see, for almost all services, you have a $0 out of pocket, except for one thing, the Medicare Part B deductible. Now, this deductible is not covered by Plan G, so whatever the Part B deductible is in the given year, that's what you would be responsible for. So you pay the first few dollars of your outpatient medical expenses each year, and then after that, you have 100% coverage. So very low maximum out of pocket. The next options down, if you were looking to save money on premium, would be high deductible G or F and Plan N. And we can certainly talk to you about them in more detail one-on-one. In the interest of time, I'm not going to spend too much time on these options today. Now, for most people, Plan F may not be available. For anybody who turned 65 or first enrolled in Medicare Part A after January 1st, 2020, Plan F is no longer an option for you. However, they did grandfather people who turned 65 prior to January 1st, 2020, and you can still purchase Plan F. But don't worry that you can't get Plan F. But as you can see, the difference in premium between F and G basically covers the deductible that you'd be requiring to pay on Plan G. So it's really a wash between the two plans. What you see on the screen here are average monthly premiums for somebody in their late 60s in the mid-Atlantic area. If you live in a more rural area, your premiums would be less than this. Certain states like New York and Florida, Massachusetts, your premiums may be considerably more than this. So let's wrap this up. What are the pros and the cons of Medicare Advantage and Medicare Supplement? So the pros for Medicare Advantage are going to revolve around all of the extra benefits that come with it and the low premium costs. And honestly, the one card that you have to carry in your wallet instead of many different cards. The cons are going to revolve around the higher out-of-pocket costs when you need medical care, doctor network restrictions and managed care, and the inability to maybe move over to a supplement once you're diagnosed with a health condition. Now, on the Medicare supplement side, the pros are going to revolve around the benefits, the low cost when you need care, also no doctor networks, nationwide coverage, no managed care, just an easy to use benefit plan. And the cons are going to revolve mostly around the high cost of the premiums. Not only do you have to pay premiums for these plans, but if you want dental, vision, prescription benefits, you would have to buy them separately and carry around an ID card for each plan that you have. So depending on your preferences, honestly, one or the other of these plans may be more attractive to you. Medicare Part D is the drug portion of Medicare. Now, if you have a Medicare Advantage plan, you purchase the medical plan, which includes the Part D benefits. So when you're looking for Medicare Advantage, you want to make sure you're going with a plan that includes the drug benefits, or else you will not have drug coverage. Now, under a Medicare supplement plan, that does not include drug benefits. So you would have to purchase a standalone prescription drug plan, which would have an extra premium for you as well. Now, it's important that we shop the plans for you because everything about the plans could be different from plan to plan. Deductibles and copays may vary by plan. Plans may cover different medications. There's a formulary list, which is the list of covered medications, and they vary from plan to plan. And they could even rank the same medication in different tiers. One carrier may have it ranked as a tier 2, and the other carrier may have it ranked as a tier 3, which would impact the copays that you pay at the pharmacy. So in order to shop, what we're going to need from you is a list of your medications, including the dosage and frequency that you take them, along with the pharmacy that you shop at, because that's going to be the best way to figure out the plan that is most suitable for you. And when we input this into the computer system, we come out with a report which shows the anticipated costs of your medications and what the premium is for the plan, so you know your total anticipated cost over the full year. In fact, we can even break that down month by month for you to show you what you can anticipate in costs over the months throughout the year. And of course, as part of our HTA VIP support service for life, we are here every year to review that for you. So when the annual review period comes up, October 15th through December 7th, reach out to us, send us an updated list of your medications, and we will be able to review that for you to make sure you're in the most suitable plan for the upcoming year. Now, all Part D plans are the same when it comes to the stages of coverage. It doesn't matter if your plan is part of a Medicare Advantage or if it's a standalone plan that you purchased with a Medicare Supplement. They're all going to follow these same 4 stages. In 2024, you will first have a deductible where you're going to pay the full cost of the medications. And this year, it can be up to $545. Now, some plans don't have a deductible. They could have less than that. Or many of them even waive the deductible on certain tiers, like tier 1 and tier 2, no deductible. The deductible only applies to the higher tiers. Once your deductible is satisfied, you're going to go in your before gap stage. And this is where you're going to pay a copay, a certain dollar amount, or a co-insurance for your drugs. The copays for tiers 1 and tiers 2 may be very little, $0, $5. A co-insurance for tier 3 or tier 4 could be in the 25% range, 30% range, or it could be a flat dollar amount like $47 a month. It's going to depend on the carrier. And you're going to continue to pay those copays until your total drug cost, not what you're paying, but the total drug cost reaches $5,030. So only those with very expensive medications are ever going to get past this before gap stage or this copay stage. Once you have over $5,030 in medications, you go into your coverage gap. And while you're in your coverage gap, you're going to pay 25% of the cost of all of your medications during that time. And when the prescription cost exceeds $8,000, that's when you're going to come out of your coverage gap. You're going to be in your catastrophic stage, which is your 4th and final stage that you'll be in for the rest of the calendar year. And great news for 2024, this has always been a 5% coinsurance in this stage, but in 2024, it is a 0% coinsurance. So if your medication costs exceed $8,000, you will not be paying any copays or coinsurance on those medications over that amount. Just like you have to pay a higher premium for Part B if you earn more money, you also have to pay a higher amount for Part D, the drug plans, if you earn more money. If you fall into that base income bracket, you would just pay the premium for the drug plan. Those premiums can be very low. The lowest cost plan this year is about 50 cents per month, but they can go up from there depending on what your prescription needs are. So base income bracket pays the premium to the insurance company. Any higher income bracket would pay both the premium to the insurance company plus an additional income rated monthly adjusted amount to the federal government for that income adjustment. A lot of people like to know what to expect in the way of premium costs when you're in Medicare. So here's a summary of all the parts and pieces together. You have your Medicare Part A at $0. You have your base income bracket Medicare Part B, and then you choose Supplement or Advantage. You see that there's some premium costs on the supplement side and no premium costs typically on the Advantage side. So depending on what type of coverage you choose, you're probably looking at about $175 to $375 all in per month per person to have Medicare. And for each income bracket, that's going to go up by about $100 a month. So here's a summary of what you can expect if you're in the highest income bracket. You may notice that the only things that have changed on this page are the Part B premium, and now there's an income-rated surcharge on the Part D drug portion. And for that reason, people in the highest income bracket are probably expecting somewhere in the ballpark of $675 to $900 a month per person in Medicare premiums, depending on the program that they choose. I hope you have a better understanding of how Medicare works and what it costs. Now let's talk about the when. When do you need to go into Medicare? Because there's a lot of confusion that revolves around this. And what you've probably noticed as you approach age 65, the mail starts coming and it says things like deadlines, penalties, must enroll. And you may be thinking, well, I'm not ready to retire yet. Can't I just defer my A or B? Do I really have to enroll in Medicare when I turn 65? What we always recommend is that you start looking into this and get advice nearing your 64th birthday or 64 and a half, because then you can get some education. You won't miss any important deadlines and you'll understand the timeline of what's ahead of you. This is what we call your pre-retirement roadmap to Medicare consultation. Many people often ask if Medicare enrollment is automatic or what they have to do to defer Medicare if they don't want to take it when they're 65. Well, that's really going to depend on if you're collecting Social Security income or not prior to your 65th birthday. So most of you that are probably still working are not collecting Social Security income, but you may have non-working spouses that are collecting Social Security income. So if you're collecting Social Security income prior to your 65th birthday, Medicare enrollment is automatic. You'll receive a card in the mail with both Medicare Part A and B. And if you want to return the Part B, the part that you pay for because you have a valid reason to defer, you just simply mail the card back, you sign the back of it, and they will resend it to you with the free Part A only and remove the Part B. But if you're not collecting Social Security income prior to your 65th birthday, you will not be enrolled in Medicare. If you don't want Medicare at age 65, simply do nothing. By doing nothing, you have deferred by default. But before you decide to defer, please make sure you're getting proper guidance, because there are some pretty significant consequences that can happen if you don't enroll at the right time. You could have penalties that follow you for life. There could be gaps in your coverage where you don't have full coverage any longer, or there could be important deadlines that you may miss inadvertently. One way to avoid deadlines and penalties is to have credible coverage. So what is credible coverage for Medicare Part B? In order to be considered credible coverage, there has to be two characteristics of your coverage. Number one, it has to be group health insurance, and it has to be provided by an employer where you or your spouse are actively employed. It's based on the active employment of the primary insured. So if you're working for a company and you have group health insurance, that's considered credible coverage. But also, if you're working for a company and your spouse is a dependent on your group health coverage, they too have credible coverage for Medicare purposes. So what's not considered credible coverage? Individual plans like ACA, Marketplace, or Obamacare, or group plans that are not based on active employment, such as COBRA, retiree, or severance benefits. They are group benefits, but they're not based on the fact that somebody is still employed at the company providing the benefits. If you have group credible coverage, you won't receive a penalty if you don't enroll in Medicare when you turn age 65. That group credible coverage is a valid reason to avoid the penalty. What I have on the page is a screenshot from our Roadmap to Medicare guidance pages, and we've developed about 16 to 20 different Roadmap to Medicare recommendations as to when you do and do not need to enroll. But one thing that's the same on all of these pages is you will get a short layman's term answer as to what you need to do and why. But if you click on the little plus sign that says Medicare Rules and Guidelines, a box is going to pop up that's going to tell you all of the rules and guidelines and link you up directly to Medicare and Social Security's webpage. So that way you can see the information sourced from Medicare and Social Security themselves, and you know you're getting accurate advice. So with credible coverage, you avoid that age 65 deadline. In fact, you can enroll anytime after age 65, so long as you maintain that credible coverage, or you'll even have up to 8 months after your group coverage or the employment that it's based on ends to get enrolled in Medicare. So you likely just discovered that you probably don't need to enroll in Medicare if you're going to continue working past your 65th birthday and stay on your group health plan. But many people tell you that you're required to enroll in the free Medicare Part A, but the thing you can defer is the Medicare Part B. So what's the truth behind that? And legally, you're not required to enroll in Medicare Part A. There's no penalty or deadline for this, assuming that you receive Medicare Part A for free. So think of it this way. What's a 20% penalty of $0? Still $0, right? So no penalty if you don't enroll in Part A. However, we typically do recommend that people take the Medicare Part A free version of Medicare when they turn 65 for a couple reasons. Mainly because it gets you established in the Medicare system and it issues you a Medicare number, which means enrolling in Medicare later is going to be a much faster process because the longest part of the process is getting that Medicare number. And hey, it doesn't cost you anything, so why not? There are certain situations where you do not want to enroll in Medicare Part A, even though it's free when you turn 65. And that's if you're making deposits into a health savings account. Because once you enroll in the free part of Medicare, you no longer qualify to make deposits in the account. And just to clarify, we're talking about a health savings account, which normally is coupled with a high deductible health insurance plan. I'm not referring to a flexible spending account, an FSA, or a health reimbursement arrangement, an HRA. So if you have an FSA or HRA, it's not going to impact your Medicare A enrollment, but an HSA will. The good news is you retain those funds and you can continue to use them for medical purposes. In fact, you can even use them towards Medicare premiums and out-of-pocket expenses once you retire. So it's a great way to save for retirement health care, but it would impact your Medicare Part A. So we always say it's important to talk to a Medicare advisor prior to your 65th birthday if you have an HSA, so you can plan accordingly. If you're on an HSA, there's some timing considerations when you eventually enroll into Medicare, because if you're over age 65 when you enroll into Medicare, Social Security Administration is going to backdate your Medicare Part A effective date by 6 months. No sooner than your 65th birthday month, but they will backdate it by 6 months, and you have no control over that. So what they're going to allow you to do in that calendar year is make prorated deposit amounts for the amount of time that you are not legally in Medicare. So prorated deposits in the amount of the number of months before you enrolled in Medicare Part A in that calendar year. Let me give you an example. Let's say you retire October 1st. So they're going to backdate your Medicare Part A till April 1st. You'll still get an October 1st effective date for your Part B, the part that you pay for, but Part A will be backdated. So you're going to look at the maximum contribution that's available for you in that given tax year for your HSA. And in this situation, you would be able to deposit 3/12 of that maximum because legally you were only not enrolled in Medicare for January, February, and March. So it really doesn't matter when the deposits are made throughout the year. They could certainly be made after April 1st, but you cannot deposit more than that prorated maximum. Now that we know that people who have credible coverage can defer Medicare after age 65 with no penalties, what kind of reporting do you have to do to prove that you've had credible coverage in order to not get that penalty? So really, there's nothing you need to do when you turn 65 to tell them why you're not taking Medicare and that you have credible coverage. The action comes when you eventually go to enroll in Medicare. So maybe now you're 68 or 70 and you've decided to retire, come off of the group health plan and go into Medicare. Well, that's where you're going to need this form. It is called a request for employment information. This is what we at HTA like to call the golden ticket. And no, it's not quite as exciting as a golden ticket into Charlie and the Chocolate Factory, but it is a golden ticket into the Medicare system. It is signed by your employer or your HR team, and it asks for a couple pieces of important information. It asks the dates that you or the employee have worked for the company, and it also asks for the dates that you've been covered under that group health insurance plan. If you're married and you're both covered under the plan, this form needs to be completed for both the employee and the dependent spouse. And it must show continuous coverage since you and or your spouse's 65th birthday. So if you've had multiple jobs, you will need this from each prior employer down to your 65th birthday. But this is your ticket in the door to Medicare. We provide this to the Social Security Administration, ask to enroll in Medicare Part B, and they give you an effective date as early as the first of the following month. I'd like to take a moment and talk about the timing of your Medicare enrollment, because although the process is simple, sometimes the timing can be very long. We know a lot of the people that we work with like to retire at the end of the year, which would mean a January 1st Medicare start date. And sometimes this can be a little tricky or a little stressful because of the sheer amount of volume that Social Security Administration is dealing with during the fourth quarter of the year. So some of the challenges of enrolling in Medicare at the end of the year are longer processing times, higher risk of mistakes or delays in the processing, and if you have to call the Social Security Administration, much longer hold times, which a typical hold time is between 15 minutes and an hour. But during the fourth quarter of the year, a hold time can be anywhere from 90 minutes to 4 hours. So getting things fixed is a lot more time consuming. Now, this doesn't mean that we can't get it done. It just means that we should probably have some attention to some advanced planning, so that way it does not have to be as stressful. So what we typically recommend is in the summertime, you start putting together your plan. This is a good time to meet with a Medicare advisor. If you reach out to HTA and schedule an appointment, we will walk you through the whole timeline and the action plan, and we can set reminders to help keep you on track. We can also go over how Medicare is going to cover you, how Medicare Part A and B work in more detail. We can look at your supplemental and Medicare Advantage options, as well as your prescription drug plans, and put together a soft plan of what you think you're going to be enrolling in for the new year. The next time you're going to want to take action is in October. That's when you can apply for Medicare A and or B up to 3 months before your requested effective date. So we always recommend that you start as early as possible, especially if you have not yet enrolled in Medicare Part A, because Medicare Part A is what establishes your Medicare number, and you will not be able to complete the rest of the Medicare process until you have this Medicare number issued, which can take up to 5 or 6 weeks, assuming that the application process goes smoothly and there's no hiccups. And the last part of the process is finalization. So we can finalize the rest of your plan designs as soon as you have your Medicare number. So if you're already enrolled in Part A, we can do this as early as October when you're starting your Part B process. However, if you are not yet enrolled in Part A, that may get extended to maybe November or December to complete the process once you get your Medicare number. At this time, we will confirm the soft plan selections that you made over the summer and make sure that they still make sense based on your current health needs, your budget, as well as any plan changes that may have been released for the new year. We can double check on all of that anytime October or later. So we'll complete the rest of the paperwork and be able to get you in line nice and seamlessly for a January 1 effective date. So the downside is if you wait till October, November, or December to start this process, you're already behind the 8 ball. And then a lot of the times we're really backing up to January 1, where we might not have a Medicare number yet or ID cards available. So it does become a little bit more stressful for our clients if they wait. Not that it can't be done if you wait, it just may not be as seamless. Another idea would be maybe just wait till the new year and after the holidays are over to start your retirement process. Talk to your accountant, talk to your financial advisor. My advice is only based on Medicare enrollment and nothing else. But if it is irrelevant to you, perhaps you start the process in January or February and plan a Medicare enrollment date for anywhere between April 1st and June 1st. Gets you right in line for retirement for the summertime, so it could be a good time for you. That is typically a great time of year to enroll because the Social Security Administration is not busy. We can get through to them pretty easily if any situations arise. And also, your Medicare number is issued fairly quickly. So completely up to you. We're here to help no matter what you decide. So we know with credible coverage, we won't have deadlines or penalties to enroll in Medicare. However, there's a difference between types of credible coverage, and that's when it comes to group size. If the employer that's providing the coverage has over 20 employees or under 20 employees. If they have under 20 employees, then you may want to consider enrollment into both Medicare A and B when you turn 65. The reason why people covered under small groups may want to consider Medicare when they first turn 65 is because if you have under 20 employees in your company, your group coverage will likely become secondary to Medicare A and B when you turn 65. That's the Medicare law. So Medicare A and B may be required even if you intend to stay on group health insurance coverage, just for the simple fact of having full benefits. Many people who work for a small company find it more cost effective to just come off of the group insurance at that time and enroll fully into all of the Medicare parts and pieces. Now, if you have over 20 employees in your company, this is not a concern because your group coverage will remain primary as long as you continue to be employed by the company. If you enroll in Medicare A and B, but maintain group coverage, A and B is just going to sit secondary to your group health plan anyway. There may be many reasons why somebody who works for a company with more than 20 employees that is not required to take Medicare when they turn 65 chooses at some point to take Medicare and waive off of their group plan. And the two main reasons people consider that is either premium cost or benefits. So if you want to do a generic cost analysis, what I would say is think about the cost that you're paying out of your paycheck plus the out-of-pocket expenses that you pay for medical care on your medical insurance plan. So your copays, your deductibles, what you pay to get services, and add that up over the course of the year. Do you think that's more or less than about $3,600 a year? If your costs are under $3,600 a year, then your group health insurance is more cost effective at this time. But if your costs are more than $3,600 a year, or if a health condition arises that you're concerned about, your expenses will be more than $3,600 a year, that may be a reason to investigate Medicare in a little bit more detail, and we can do that one-on-one with you. Another consideration is dependent spouses. So a lot of the times, the employer contribution toward the medical premium for dependent spouses is not as high. So we do find that often when dependent spouses turn 65, they find Medicare more cost effective. So let's say that you decide that Medicare is right for you. When are the valid times that you can waive off of your group health plan and go into Medicare? So a valid reason to opt out of group insurance mid-year would be turning age 65. You can also opt out of your medical insurance any year at your medical open enrollment. Obviously, retirement is a valid reason to come off the plan. But believe it or not, maybe any time you decide you want to enroll in Medicare after age 65 could be a valid reason to come off of your group health plan mid-year. So I would encourage you to find out from your employer if quote unquote enrollment in Medicare is a valid reason to opt out of your group insurance mid-year. If so, you can stay in your group insurance as long as it continues to be cost effective for you. But if ever there's a day that it's not cost effective, you'll have the option to opt out at that time. Let me give you an example of how this may be valuable. We had a woman who approached us one year around October 15th because she had found out that she needed a hip replacement in November. And under her current health insurance plan, it was going to cost $6,000 for that hip replacement because she had a high deductible health plan. But under Medicare and a Medicare Supplement Plan G, it was going to cost her less than $250. So she decided to enroll in Medicare and Medicare Supplement Plan G for November 1st, and she was able to get that hip replacement for under $250. So because she was unable to disenroll from her group health plan with a life event of quote unquote enrollment in Medicare, she was able to get out of her plan mid-year and save $6,000. Just be careful if you have a spouse dependent on you for their benefits and they have not yet turned 65. Because if you come off of your group health plan, you may force them into a COBRA situation. So we've talked about credible coverage. And if you're with a company with over 20 employees, you're not required to enroll in Medicare A or B when you turn 65. If you're with a company with under 20 employees, you may need Medicare to have full coverage. But now let's talk about the last category, the people that absolutely need Medicare once they turn 65 or find themselves in this situation. And that's going to be the non-credible coverage, people who are on individual plans or group plans like retiree, COBRA, or severance. So if you have non-credible coverage, you will receive a penalty if you don't enroll in Medicare when you turn 65 or as soon as you find yourself in this type of coverage. Also, Medicare is going to be needed as your primary insurance, so you'll need it for coverage reasons as well as penalty reasons. So your options would be either to keep your current health plan as secondary and enroll in Medicare A and B only and put that in as primary, or you can drop your current coverage and enroll in all parts and pieces of Medicare as your new coverage. I want to take a moment and focus on COBRA, retiree, and severance coverage. So if you are retiring and you decide to go into Medicare and you have any dependents on your current group health plan, not only will they qualify for COBRA, but they may qualify for COBRA for an extended period of time because you don't elect it to go on to Medicare. So you don't need to take COBRA in order for your dependents to have access to it. Most people that are Medicare eligible will choose Medicare over COBRA. For those of you that are on retiree coverage, typically what you do is just add the A and the B as primary when you turn 65. The retiree coverage will remain in the secondary payer position, and you will not need to look at Medicare Part C or D. And lastly, with severance coverage, if your employer is willing to provide you benefits after you leave employment for a certain period of time, even if they're willing to pay for those benefits, they're not based on active employment. So you still need Medicare Part A and B, or you can find yourself in some trouble later. So many times it might make sense to negotiate with your employer and say, instead of providing me with the group benefits as severance, would you consider funding my Medicare as severance benefits? That way they can help cover that Part A and B expense, and you're not taking on an additional expense just to have the severance benefits. Okay, so I know that was a ton of information, but hopefully you have a better idea of when you do and do not need to take action with your Medicare enrollment. The last thing we're going to touch on is how to take action, whether you're deferring or enrolling in Medicare. So depending on what timing you're using, your enrollment or deferral dictates the actual process on how to do it. So we've created an informational webpage with step-by-step instructions on how to do each enrollment process. We're here to hold your hand through the whole process and explain everything to you and help you troubleshoot with any issues. So I want to thank you for the time that you spent with me today learning about Medicare. I really hope that you're walking away with at least a couple pieces of information that you didn't know before, but you do not have to retain this information. Simply just call us if you need anything. If you're approaching age 65 or retirement and you're looking for some guidance on Medicare, either scan the code on this screen or you can go right to our HTA-insurance.com/schedule page to schedule a one-on-one consultation. As mentioned earlier, we don't charge anything for the consultations. You never pay more for the insurance, and you will be welcomed by a warm, friendly Medicare advisor that's going to walk you through the whole program. This year, we completely revamped our Roadmap to Medicare presentation. So we hope that you could take about 30 seconds and complete our quick survey after this webinar. Simply click on the Leave button and a survey should pop up for you to answer a few quick questions to provide us valuable feedback and continue to improve the webinar for future. I'm going to leave this window open for about 2 minutes. This is your last opportunity to type questions into the chat box or to download the copy of the PowerPoint slides through our Documents icon. thank you again for your time today. Let us know when you're ready, and we are here to make this process easy. Have a great day.